Myofunctional orthodontics utilizes many of the same techniques as traditional orthodontics. All those strategies are still used, but the main distinctions would be that we aim to treat really young. We ideally are going to be evaluating before the age of 7. In most cases, we'll want to treat both jaws. We can make sure that we get the upper jaw to the full potential that we want. We also want to use sleep metrics and monitoring symptoms to help us determine the treatment plan and the endpoints, not just the tooth position. Our goals at the MyoGrow program are, of course, to have the tongue up, lips closed, nasal breathing, and a correct swallow pattern. To develop that foundation young, so there's room enough for the teeth and there's room enough for the tongue. The goal is to get to puberty without needing dental extractions to straighten teeth. In order to accomplish that goal, we want to start from a young age, developing and growing that foundation. Early intervention is really important for facial growth and development, and it's a topic I'm really passionate about because the cranium is actually 50% done growing by age 2, and the brain is 90% developed by age 4, and the upper jaw is mostly done growing by age 8. So traditionally, if we're just looking at teeth and we're treating at age 12, we've missed a lot of that growth that happened so early on. There's a lot of published and studied health benefits in the literature about early intervention orthodontics, and I want those benefits young when that growth is happening, because that growth is happening exponentially when they're little. We can definitely wait for treatment, but by waiting, we're missing out on those health benefits for those growth patterns that are happening young, and that's when we can have the most health impact. So if we can improve the breathing and the sleeping when they're young, it really has the most impact on their health, and that's my goal. There's a lot of treatment options that we have at the Myogrow Airway Center, and I tell patients that we think of this area as a box. There are 3 different dimensions that we would treatment plan for: the side-to-side dimension, the vertical dimension, and the front-to-back dimension. We may want growth in different aspects of those dimensions. So depending on those goals, the age of the child, the preferences of the family, the compliance of the child, and treatment time, those will all factor into which methods that we'll use to treat. I know going through this process can be kind of overwhelming for families because we have busy lives and we have big families and lots to do. I know it also seems like a real shift from what we did growing up. So as parents, we kind of did things a little bit differently with regards to dentistry and orthodontics. What's amazing is that we know all this now and we can offer this to our children because we always want better for our children. So as a family practitioner, I really see that full kind of spectrum of effects of airway compromises, and I know it can have a really big impact on people's lives. So we probably all know somebody who snores, uses a CPAP, has sleep apnea, can't sleep in the same bed as their partner because they snore too loudly, or falls asleep watching a movie, gets tired at work and has to have 2 cups of coffee every morning to function. We see that a lot. We see that generally in our society, and I want better for our kids. So really, we adapt to be able to function, but if we could just address those issues early in life, we'd be much better off.